Good morning. Today I will talk about OCD treatment, the fantastic OCD treatment that we're doing here in Oslo now in Norway. And to do that, I'll try to make it as simple as possible. Most good treatments are extremely simple. The principles are simple. They are difficult to put in practice, but the principles are extremely simple. So the principle of OCD treatment and a lot of anxiety treatment is exposure. Do exactly what you're afraid of doing. And do it as often as you can, for as long as you can, as intensely as you can. Now, how intense the anxiety becomes is not in our control. This is the automatic nervous system that we're dealing with. And how long it lasts is not in our control either. But what's in our control is how often we try. How often you try to get into situations that you're very afraid of. How often you actually try to become anxious. You go into situations that you typically know will make you very anxious, and you stay there. You don't run away. And one important concept in this is so-called leaning into it. That means that you really do it with all your heart. You don't break. You don't put the one foot on the gas pedal. You say, "Yeah, I'm going to do this," and another foot on the brake pedal, and say, "Oh yeah, but I'm just gonna wash a lot after I've done this exposure training. I'm not really going to really do it because that's too scary." Okay, that's not really going to work. Imagine, it's a true story about a cat that was raised in a hotel, and he had been taught very clearly to not go into houses. It was okay for him to be outside the hotel, but they couldn't have him inside the houses. So he had been severely punished every time he went into a house. So this cat was adopted by some people, actually some psychologists, and they wanted him to get into their house, of course. But he stood at the doorstep and did not dare to cross it. Okay, and they coached him and encouraged him to come in. And finally, in a way, in panic, he just jumped into the house, and then it was okay. But to cross that threshold was very traumatic. But every time he crossed the threshold, he did it the same way. It was very, very apprehensive, and then suddenly jolting in over the threshold. So since he did the same thing, same defensive thing, you might say, every time, he never learned that he could just cross the threshold in a normal way, like a normal cat would do. Every time he had to jump over the threshold in fear. So this is what we want you to avoid. To do the exposure with fear. And you just associate fear to that specific thing, just like the cat. What you should do is that you should do it as normally as possible, like a normal person would do it. Okay, so now to illustrate this, I will play patients, typical patients, since I can't show any real patients. Actually, I've had some of these things myself, so I'm as real a patient as they come, but I'm going to pretend that I have a few more symptoms than most people have. Okay, so when I'm going to be patient, I'm going to sit in another chair and I'll take off my glasses. Okay. So now I'm going to start as a psychologist. Okay, so now tell me a little bit about the kind of problems you have and what you think could be an exposure training for you. And you can also say a little bit about what you think are going to be the problems. Well, one of the things that I'm very afraid of is that I will destroy something for other people. That I will get other people infected with some kind of sickness, or that I will let them get accidents. For instance, I will wash my hands a lot in order to avoid that I contaminate somebody. And if I see a stone, a small stone that's on the road, I think that somebody might hit that small pebble with a bicycle, and I better remove it. Since I know about this now, it's my responsibility if somebody hits that small rock. Okay, that's very good. It seems like you have a good understanding of actually the thing that you have a problem with. It's a normal thing, in a way. You want to take care of people, but it has gone over the top. That's a typical thing with OCD. It's usually a normally good thing, but it has gone over the top. So now, when you're going to train on these things, you have to do training. You can't just do the normal thing. It's like if you're going to become a very good runner, you can't say, well, I think I'm going to become a runner just by walking or maybe slightly running, that like most people do. The normal kind of physical activity, that's going to make me a really good runner. No, if you want to be a good runner, you have to try a lot harder than what most people do. You have to train, you have to really train. Okay, so let's see now what I can do. I can try, I think you mean what I should do is that I should deliberately try to do some of these things that I have tried to avoid in a way that I will know what is really dangerous and what is OCD. Or as you have said, if I'm doubting whether this is typical OCD behavior, I should say that, okay, this is another doubt, and doubt is OCD. So if I'm in doubt, I know it's OCD, and then I should just do it. Okay, so what I can do is that I can, one thing I'm especially afraid of is infecting vulnerable groups like children and old people. So how about if I go to a supermarket and I touch, without washing my hands or anything like that, I can even maybe cough a little bit in my hands, and then I touch diapers and baby food and maybe some baby toys if they have that, so that I in a way risk infecting children, because the parents will touch these things and then they will touch their children, and then they'll get my germs on the children, and then it's my responsibility if this child becomes sick. Yeah, wow, you really got it. That's a really good exercise. Okay, so that was with the touching. Are there some other things that you can do? For instance, countering this thing that you have to remove all kinds of pebbles and small possible dangers that you can see for other people. Well, maybe I could actually spread some danger. I could put out some pebbles on the road. I've heard some people, they actually break a bottle and then they place some broken glass somewhere. Oof, no, that might be too much, I don't know, but yeah, okay, it's like the hard practice. You know, after all, it's up to people if they are careful enough. I can't be responsible for everything in this world. I can't save everybody. There are a lot of pebbles, there are a lot of glass things out there already. I can't go around and removing all the broken glass in the world, so yeah, maybe I could do that. Okay, but then I'm also very afraid of ovens and electrical things, anything that can catch fire. Iron, curling, like these things you use in your hair to straighten the hair or to curl it. if any of these are on, I have to check that these are off. The oven, dripping taps, because there could be a flood. Okay, so if I understand correctly, I should try to leave the house. They should be on, and then maybe I can turn them all on, and then I try to turn them off as fast as I can, and then I just leave. This is what I need to practice, because I can use hours checking again and again and again that things are off. So how should I do that with the checking of ovens and doors and things like that? Yeah, this is perfect. Anyway, spread all the kinds of problems that you can, including broken glass. Another suggestion is that you could leave some paracetamol tablets around, because you never know, somebody could pick them up and take too many and they will die from it. You never know. Okay, so because this is training, this is more than what is normal. You are allowed to do this just to train, to get over it. You have to go the opposite way of what the OCD tells you. You can look upon the OCD as your enemy. Some people like to even give it a name, give it the name of the most irritating, obnoxious person that you know. And that could be a way of talking about it. If you give it the name of a name that you really don't like, that will help you to externalize the OCD and see that this has become your enemy, and you're not going to give in to this. Okay, so when it comes to the checking of ovens and things like that, which is very typical. Almost all people who have OCD, or a lot of people who have OCD, have this thing with electricity and thing catching fire or floods or things like that. So good idea that you turn everything on very quickly, and then without looking back, without checking again, without turning around, you just quickly turn them off, and then you leave the house. You don't go back. Same thing with checking the door. You just lock it and then you go. Okay. So even if this seems hard, if it seems too hard, okay, you can do slightly gradual, but it's better to just go for it at once if you're able to. A lot of people are able to when they are on these training things that we do. They get so inspired, they see other people doing the same thing, so they go for it at once. What you can do in addition is that you distract yourself while you turn off the things. And when you get the doubt, you say, yes, okay, so good. This is exactly what I want to have. I want to have the doubt. This is like when the athlete feels the burning in the muscle, the burning in the chest, then they know that they've really been training, they've really been practicing. I think I get it now. So what you're saying is that I should get the anxiety. I shouldn't be afraid of the anxiety. That's actually, like you say, it's the athlete that feels it in the muscles. Okay, so I should go for anxiety. I should go for the insecurity. I should actually make myself more insecure. Yes, I think you really got it now. I think you understand it. Okay, you should go for the insecurity. Any kind of exercise that makes you really insecure, including insecurity about is this OCD or not, perfect. Okay, so think about that you're the athlete. You've got the world's best coach that has told you that you should do these kind of exercises that make you really anxious. And no pain, no gain. If you don't feel anxious, it doesn't really hit you. So then you should do something else that really would get your anxiety up. So it's like training. It's like training to tolerate the insecurity, and through that you have to get up the anxiety in this training period. And then after that, it's going to be a lot easier. You're going to be able to live like a normal person. But in the training period now, you have to really go for it. Do it more, as frequently as you can, and your goal is to get up your pulse, to feel it in your legs, so to speak, to get that insecurity and anxiety.